Dr. Yetunde C. Adeniyi is a Nigerian child and adolescent psychiatrist, academic, and leading specialist in neurodevelopmental disorders based at the University of Ibadan. She serves as a senior lecturer in the Department of Psychiatry and is a consultant at the University College Hospital, Ibadan, where she heads the neurodevelopmental unit and contributes to the advancement of child and adolescent mental health services. Adeniyi is among the pioneer graduates of MSc Child and Adolescent Mental Health, programmed at the Center for Child and Adolescent Mental Health, CCAMH, earning her degree with distinction and focusing her research on neurodevelopmental conditions. Over the years, she has built a distinguished career centered on the care, research, and advocacy for children with developmental disorders, particularly autism and intellectual disabilities. Her work spans clinical practice, teaching, program development, international collaborative research across several African countries. Recognized as one of Nigeria's first locally trained specialists in child and adolescent psychiatry, she holds fellowships and advanced certifications in psychiatry and has played a key role in establishing and expanding child and adolescent mental health services at University College Hospital, Ibadan. She is also the director of the Center for Early Development, Child and Care, CEDLAC, CEDLAC, a multidisciplinary center providing specialized services and training for professionals working with children with developmental challenges. Beyond clinical work, Dr. Adeniyi is actively involved in capacity building, including training healthcare providers using the World Health Organization's 𝐸HGAP program, and has supervised numerous postgraduate research projects across Africa. Through her research and leadership, such as her involvement in international studies on environmental and developmental health, she continues to shape policy, practice, and knowledge in child and adolescent mental health, both in Nigeria and globally. Ladies and gentlemen, help me make welcome Dr. Yetunde C. Adeniyi. Good to have you here, ma.
Fine, thank you. How are you?
I'm very well, thank you. Okay, so without wasting much time, we're going to go straight into the interview. Thank you so much for the opportunity to have this time with you. I appreciate your time on behalf of Fednat Foundation.
You're welcome.
Thank you, ma. Okay, so we're going to start off with an introduction. You have a very long bio, very impressive one at that. But I just wanted to introduce yourself to our audience, ma.
Okay. So my name is Yetunde Adeniyi. I am a child and adolescent psychiatrist with the University College Hospital Ibadan. I'm also a senior lecturer with the University of Ibadan. My area of interest is in neurodevelopmental disorders, especially autism spectrum disorder. But apart from working within the two institutions, I also work within the community. I founded a center about 10 years ago that provides services for children and individuals with neurodevelopmental disorders, including autism spectrum disorder. Among other things that I do, capacity building, research, and lots of other things.
Amazing. Thank you so much for choosing this career path, because we really need people like you providing the services that you provide, providing the help that you do for our brothers and our sisters who need that help in that regard. Thank you so much. So can you walk us through your educational journey from medical school up to postgraduate training in child and adolescent psychiatry?
All right, so my medical school was at the University of Ilorin, and I graduated in 2001. Of course, the 2 years after was for the mandatory internship and NYC in Katsina State. And I stayed back a little bit in Katsina State for about 18 months to work with the Katsina State government as a medical officer at the General Hospital in December.
Okay.
But then I came to Ibadan because of marriage. I came down to Ibadan. and I joined the Oyo State government to work at the state hospital before I started residency at the University College Hospital. So I had my residency in psychiatry at the University College Hospital, where I became a fellow of the West African College of Physicians. I immediately proceeded to have a subspecialty training under the National Postgraduate College. So that's basically um, just having training in looking after children and adolescents with different kinds of mental problems. And then one of the very few who have that qualification in Nigeria at the moment. I also have a Master's of Science um, certificate from the University of Ibadan in Child and Adolescent Mental Health. So basically, that's my journey. But then I joined UCHUI at, at different times, and that's where I am from now.
Oh, wow. Amazing. Well done, ma. So, would you want to
Thank you.
explain a little more about your clinical training experience, especially your time at the University College Hospital in Ibadan?
Yeah, I mean, what's amazing, as we know, UCH is at the forefront of healthcare in Nigeria. Even though it's still a far cry from what is expected, but when talk of Nigeria within the country comparison, it's at the forefront. So I had a robust training, especially because it was a teaching hospital. So I had the opportunity to interact with other professionals, pediatricians, the neurologists, different kinds of people, radiologists. So it wasn't, there are service hospitals like the neuropsychiatric hospital, Aro, Yaba, and other that are purely
Yes.
psychiatric hospitals.
Yeah.
But teaching hospital is a bit different because they have a whole lot of other specialties there. So that makes it a little bit more unique. Um, so at the early parts of my training, it was still like a whole lot of people, professionals around. Unlike now, when most people have traveled and all that.
Yes.
Um, it was more. There was a whole lot of commitment of wanting to just give back and give back and give back before the the Jackpot syndrome took over almost completely. So it
Yes.
was, and then we have patients from across the country. It's a referral center, so we have children, adolescents, people being referred from different parts of the country. So it was a robust and well structured program that I had.
Okay. Thank you so much. That was really elaborate. So, from your angle, from your perspective, can you share a bit about how autism spectrum disorder is seen by our society? What are the early signs and core symptoms that parents or caregivers should look at? Okay, so I think we can take the second question first because it's very important and let it stand alone. So, what are the early signs and core symptoms that parents or caregivers should look out for? Are there like early symptoms that are common in Nigeria experience, and how can we be able to pinpoint that?
All right, thank you. So like we know, autism is a neurodevelopmental disorder. What that means is that it affects the early years. The symptoms start to show at the very, very beginning of development. So in our environment, the commonest presentation of autism is speech delay. That's like the one that is almost always present when children present with autism, and it's the one that is very distressing to parents. So they have speech delay. Um, some of them might have started talking. Okay, that's one pattern that is also common. Some of them will have started talking, and then at about 18 months, 2 years, the words will start to disappear. So
Okay.
that is one of the reasons why there is delay in presentation, because the parents are thinking, okay, maybe it's just a temporary lost. Like it's going to come back, especially because it's spoken. They start to call mama, dada, water, and all that. So they
Yes.
don't present on time. There are some children who would have never started to talk at all, and then they are approaching 3 years, 4 years, 5 years, and they're still not talking. Some of them have started picking words, but then when you compare the age to how much they are saying, you know that it's way below what we expect for that age.
Yes. Okay.
So that is one major presentation. Speech difficulties, communication problems is one. The other one is that they might have problems with social interaction, so they prefer their own company. They
Okay.
want to just be by themselves. So they prefer to describe them as being in a world of their own. So they rather just stay in a corner and be playing by themselves. So they don't, they're not interested in social interaction, even with their parents or with their siblings or with their peers, for those who are in school. They might have repetitive behaviors of different kinds. It's ended, actually. But the common ones are like they might spin on the spot, they might flap their hands, they have repetitive hand movements close to their eyes. They do a lot of some of them walk on their toes, they tiptoe. Some are fascinated by different things, maybe color or sound or smell or touch or
Okay.
things that spin. So they are just fascinated by all these things. So they have different kinds of, some are just, they sit and they rock back and forth, or they tap things, or they do different things that you know that it is, there are things that they do repetitively. Some of them I have some other problems that are self-injurious, like especially for those who they started growing and they still do not have words because of the lack of communication. They have frequent tantrums or meltdown, so they might just start crying, throwing themselves on the floor. They might bite themselves or pinch themselves or other people, and that makes it a little bit more difficult for them to get help, especially for their parents to get some respite because um, most people don't want to take a child that will bite or pinch them. So
Yes.
that's they can also do that. Some of them might have other challenging behavior, head banging, throwing things when they are upset, and so on and so forth. But the components, like I said, is speech delay and poor interaction with the people around them.
Oh, this is very helpful. And I'm sure that our audience who are watching, for instance, an expecting mother or a wife who is still waiting to have baby can be able to look out for these signs early enough. So my question before I go to, we're going to talk about the cultural predisposition that we have towards people with autism. But let's talk about what parents can do. As soon as a parent starts noticing some of these things that you've mentioned, what are they supposed to do immediately? Especially the
All
early
right. So
signs. Yes.
yes. So the first thing look is to first of all confirm that there is autism in the person because there are some children who just have speech delay. They don't
Okay.
have autism. So it's better that the child is assessed by a professional, somebody that can say, oh, this is autism or this is not, or give
Okay.
some other appointment and say, let's see him in another 3 weeks or another 3 months or something, so we can really be sure. It's important that that happens so that you don't keep guessing and going back and forth. It is not, it is, that has to be clear. I
Okay.
know that sometimes parents are very reluctant to do this because it's like they are going to get like a verdict. Say, oh, I just want to stay in my ignorance. I'm
Yes.
not. It's better that nobody's telling me that my
Ignorance is
child has
bliss.
autism. So, but then it's not helpful to the child. You might not even like, so for sometimes I tell parents that okay, we might not use this label. You don't want us to call it autism. That's okay. But then we know that the child has speech delay, they have social interaction. We can address by symptoms and look at what we can do and provide intervention. So it's important that the child is seen by a professional. That's the very first step. And of course, subsequently, the days after that might be a bit tough for them because it's like some of them might have been suspecting that it is, but when you tell them, it's like, oh, it is true. They were hoping that we were
Yes.
going to say, "Oh, don't worry, the child will be fine," and all that. So they might go into some. They might just go. They might not act almost immediately. They're just processing and trying to figure out what to do. Some might try to do other things based on our culture. We are very prayerful people, very spiritual. So we want to take it into prayers. We want to call our pastor. We want to do. Those are fine and they are valid. But it's also important that we step out and look for support and intervention for the child. So the first is assessment. Second is to look around for what is available, what kind of help can this child access where we live at the very moment. I mean, it's not like the help is readily available. That is
Yes.
another part.
That's true.
Maybe we're going to talk about it. But there are little help here and there, pockets of intervention. Somebody is doing something here that can be useful. There's a school that has some knowledge. There might be some like that around that person that they can immediately assess where they start to plan for long-term help for that child. So it's very important that they they come for assessment, process it, which is ordinarily they should be supported through the period, some psychological support to the family, to the parents, the siblings. They should get some support at this time. But sometimes it's not happening. They're just by themselves trying to process and understand what is happening. So
Yes.
so it's very important for early intervention, early identification and then intervention. So of course.
Okay, thank you so much. I know that, of course, nobody gets pregnant and hopes they're going to have an autistic child. It is often an accidental thing. It's often something that nobody prepares us for. But I'm glad we have people like you in the field who are making it easier, both for the family and for the child, the individual themselves. So let's talk about the cultural beliefs. So, Doc, how do cultural beliefs or societal attitudes in Nigeria influence how autism is perceived or managed? And what challenges do families in Ibadan or similar, settings face when seeking care for child with or children with autism? You already mentioned a bit of it, which is that, it's not always the care, the centers and the help is not always available. But let's talk about the cultural beliefs and the societal attitudes.
Okay, so thank you very much. I mean, I would have loved that the response that I have is not the response, you know,
Yeah.
because it's still really very sad. So this time last week, we were organizing a training for schools, at my center, and then on Thursday we had our autism celebration because of the break. We wanted to have it before the schools were closed. So prior to that time, we had gone through schools to invite them for the program. They say, okay, come, you're not paying anything, just send in two teachers from your school. At least you have two people that can identify and say, this child looks a bit different, or is not developing, or is not learning. So you can then say, okay, what can we do? It was really very shocking to see the number of schools that refused to come for that training and the reason is because they would not want to come and contract whatever the children that we have in our center so that they don't go take them. I mean, it was a whole lot for me to process.
Wow.
You schools that are manned by educated people, they bluntly would say no, we are not coming. In fact, a school told us that it was as a result of a spiritual attack that we're just wasting our time trying to look after these children. So I mean I thought that we had left that level. I was thinking that okay, we've been on the radio, we've talked to people, there are some centers, people have been talking about autism all the time. There are so many people. If you don't have a child, doesn't mean you know somebody who has you have.
Yes.
It was so shocking to me that people are still at that level of not even interested in knowing more about what is going on. So that what that tells me is that we are still really far from where we're supposed to be. We
True.
have a whole lot of beliefs that are impeding and standing in the way of people or children who have autism to receive the appropriate help. Because for me, school is a place where children should get as much help as possible. And that was what I thought about. Let's go through schools because parents or grandparents or some other people might have reservations, but a school is a place of learning where you expect that the people in charge will have a little bit more openness and understanding. But it wasn't true, or it's not true.
Wow.
So there's still so much that we need to learn and unlearn as a society. That's like I said, one of the schools said it was a spiritual attack that is as a result of some jinn. It was a Muslim school that it was there's something that they call jinn in Islam. That is as a result of it that everything medical that we're doing is a waste of time. That there's some kind of prayers that they're supposed to do for the children. So we still have those beliefs. Some believe that if a family has a child with autism or other disabilities, that is because they've done something wrong. That it's a kind of punishment from God. That the families are receiving that punishment, or they feel that child because God is punishing them for what they've done. So it's still a whole lot that is going on out there. And so I can then imagine families who have children with autism living within the community. What do they face on a day-to-day basis? You have a child who is constantly screaming in the night, and you have neighbors because some of them have sensory issues. If there is too much sound or too much noise, they can just start screaming. Some of them don't sleep well at night. So how are those families coping with their neighbors? What kind of support are they getting? What kind of understanding do the neighbors have of those kind of children? I've experienced it a couple of times in a supermarket when a child that clearly has autism or some kind of disability would go into a meltdown within the supermarket. You can imagine if you have a mother with a child and child is all over the place on the floor screaming, about 7, 8 year old, and everybody's thinking, what is wrong with this mother? Can't you spank? Can't you just get a cane and flog? So people just necessarily believe that it's poor parenting, that the mother is not able to handle or take care of the child. So, because many people do not understand that children can genuinely have distress by coming out of their house of their where they are familiar with, they can go into meltdown and have difficulties just coping outside. So there's still so much that needs to be done. And I mean, at this point, I mean, I'm not tired, but it's just it's so overwhelming to know that we still have so much to be done. I thought we've done a lot and that people should just know we know about autism. I know the thing about that those schools that refuse to come for this training most likely have students who have autism or who have other kinds of disabilities. So you're now wondering what are they doing to support them? How are they learning? What kind of support are they getting? What do they tell the parents? So those are the issues. There's still so much that we need to in terms of awareness, in terms of education, in terms of people accepting that it is a medical condition. And there are interventions that can help children who have autism.
We don't have this kind of conversations. You don't realize the different world that they live in. And it can only take you experiencing it firsthand to really know that they go through a lot. And I think parents who have autistic children really deserve so much support. Like you said, not just the parents, their family members as well, because they have a lot of things to unpack almost every single day from their children, from that particular individual. And it's a lot to deal with at every single time. So let's talk about something that has been in the news recently, Doc. I'm sure you're aware, I guess you're aware of the recent saga on social media. So recently there's been a discussion about an autistic male patient adopted by a prominent church leader who reportedly exhibited hypersexuality, impulsivity, and compulsive disrobing and difficulty respecting boundaries with members of the opposite sex here. The minister of God reportedly suggested that marriage could help manage his behavior. Now, allegedly, a woman agreed to marry him and was offered so much: a house for the couple, an overseas vacation, a 20 million naira promise after 10 years if the husband remains alive, and of course, a cash gift of about 10 million naira or so. As a professional, what are the interventions that you will, first of all, what's your take on this particular issue? I mean, it's been on the social media recently for, you know, and the noise has been there. So as a professional, what are the interventions that you will suggest for family members struggling with an autistic individual exhibiting hypersexual or...
Yeah, thank you very much. So autism, as it were, mostly does not affect physiological growth and development. So people, individuals who have autism who attain puberty, they start to menstruate, their hormones will go up and down like the rest of us. So there are parents have done or families have done different things to manage this in the past I'm aware of. There is no one size fits all for everybody. It depends on the child, it depends on the family. Some have gone ahead to put their female child who has autism on hormonal therapy to stop menstruation. Of course, if there's no menstruation, they're not likely to be able to have children. That is their own choice. That's the way they wanted to do it. Like we saw on that on the clip of that of the young man that got married. Some family has also gone ahead to arrange somebody, especially for the man. If the person with autism is a man, they get a woman to marry him. Especially if the family is able to take care of the woman. So those are different ways by which people have gone to do that. The case in question was a bit of an extreme one because I mean the time that it happened was very short. I think it was within a few days that everything was put together. The woman indicated interest, and in no time there was marriage. I mean, to people who are human rights activists and who are really into why that who have disabilities or special needs to make their own choices, they might frown at this because it wasn't so much of what the guy wanted. I mean, even though he expressed that he was sexually active and has high libido, it wasn't any of his choices. He didn't so much have anything to say to what was happening. People were making plans and doing everything for him. So some people might say that is absolutely a breach of the right of that person. But there are some other people who then say also that, oh, it was a way to help him. At least it's shown that he's matured, he's an adult by age, and then he was ready. And then there was someone that was willing to go ahead and marry him. So it's not there's no single answer. But what is clear is that they also have feelings, they have desires. They also go through the normal physiological process that we all go through. So they have sexual needs, feelings, they are attracted to somebody or someone at different times. So families can decide what they want to do, or their therapists can help in terms of what is best for this particular person at this time.
Okay, amazing. So can you share your experience with medication management for autism in Nigeria?
All right, so as it were, globally, there is no medication that has been approved in the management of autism. You know, when people have malaria fever, they say, "Well, go take anti-malaria." When there's an infection, we'll take antibiotics. But there is no drug that is an anti-autism yet anywhere in the world. Now we have medications that are used for different reasons among people who have autism. We have those who are used for associated problems. Sometimes when people have autism, they also have other problems. Like they might have problem with sleep, they might have problems with their appetite. Some of them might have some kind of epilepsy or social disorders. Some of them might have ADHD, which is attention deficit hyperactivity disorder. So sometimes, because of all of this, we can prescribe medication. Prescription medications are mainly used for associated problems or some challenging problems that they might have. But for the symptoms of autism as it were, there are no anywhere in the whole world. There are no medications yet. There are research, different studies ongoing and all that, but none has been confirmed. But then we know that on the internet, on the web, there are a billion different kinds of drug medication that is being marketed for autism. The truth of the matter is that because I work in both ways, I work in the hospital, I'm in the private sector and in the public sector, I am in the middle, as it were. Because families will come and say, "Oh, I saw this online. Somebody told me this. I used this for his son, and he did well. What do you think?" So I'm constantly being forced to make a stand or take an opinion about something. So what I say is that if you have read about it, if you have the money to buy it, if you are comfortable that it's not going to harm your child, and you are convinced that you want to buy it, go ahead and buy it. But I usually will say that there is, when you see a report about a drug, right? If you read further, you will then see about five other reports that are not positive about the same drug or the same supplement or the same, you know, additive or something that a parent will say, "Oh, my son took this and in 2 weeks he started talking." Five other people will say the opposite about the same drug. So you might want to test so many things or so many medicines, so many diet type, supplements, and so on. It is fine. But in clinical practice, we use medication in autism to treat all the other associated problems. We call them comorbidity. That's what we use medication for. And in Nigeria, interestingly, we have quite a lot of medications that we can use. Apart from the prescribed medication, we also have all the diets and all the supplements and everything. It's also present. It's just a matter of a click on your phone, and they are at your doorstep if you have the money. So that is what it is about medication. I know because families just want to help their children, which is fine. They want to do everything. They are looking for all the solutions that could help their children. It's not easy to say, don't, no, don't do that, don't use it, don't, because if I'm saying that, that means I have a better solution. That means I have something um, that is better that I want to provide, or I'm able to solve the problem on the spot. I can't solve the problem on the spot for them. So I don't have all the right to say, don't take that drug that you have seen or that you are drawn to. Okay, I could just say, I encourage them to say, please read very carefully, look at what people are saying, observe if we eventually start, observe what is doing to your child so that it's not causing more harm
Yeah,
to the
that's good.
children.
Of course, if someone has a need, then anywhere they see what looks like solution, they want to go there. And
They want to go there.
yes,
And you can't stop them. You can't say don't go there. If you are
yes,
not able to provide 100% of solution to that problem, it's difficult to say don't go.
yes, you're right. Okay, so Doc, finally, let's talk about what type of therapies or behavioral interventions that are currently available in Nigeria. You've mentioned that there are different expressions of autism, and it's not like it's one particular thing. So, are you aware of any therapy that is available or interventions in Nigeria?
All right, so there are universal therapies that are prescribed for autism, and so is what is available globally. What might be different is the quality that is available where we live. So we know that speech and language therapy is top. Remember when I said that one of the commonest symptom of autism in our setting is speech and language problem. So speech and language therapy is at the core of what we do for children with autism. And it's getting better with time. In the past, it used to be Lagos and Abuja, where you can use to go, access, language. But in Ibadan, we have speech and language therapists, even though, of course, they are quite few, but then we have them. We have centers that can also provide speech and language therapy to children who have autism. So another important therapy is applied behavioral analysis, which is commonly known as ABA. ABA is also really very useful. It has been well researched, has been well documented. The effect on children with autism is quite significant and is very useful. So especially for those who have behavioral issues alongside the symptoms. So we have that. Of course, like I said, people do a lot of things in the name of ABA, but at least that is better than nothing, really. So it is a very systematized and well structured program. It's not just anyhow therapy. So ABA is well systematized, is a well arranged and well structured program. And it is also available in different parts of the country, especially in major cities like Lagos, Ibadan, Abuja, and some other places. So that is number two. They also need so part of the problem that they might have will be things about their daily living activities, ability to take care of themselves, brushing, bathing, being able to dress for themselves. Some of them cannot even feed themselves. They are about 5, 6. They still be preferred that their mother will feed them. So that that group of symptoms usually is taken care of by occupational therapists. So they are the ones that would help with all these daily living activities and help them to be able to be independent of other people when it comes to looking after themselves. So that kind of therapy is also very important. We also have those who might need some kind of physical therapy. Some might need play therapy, sensory integration therapy. They are all kinds of therapy that are needed. But because they are highly professionalized kinds of therapy, not everybody that can provide it. Okay, sometimes when someone who has training in ABA is quite good or has a lot of experience, might be able to touch on some of these things. Okay, and a good speech therapist also might be able to do a bit of occupational therapy here and there. So, but largely these are some of the things that are needed. Apart from that, they might need medical attention for different things at different times, which again should be provided by either a child psychiatrist, a pediatrician who is trained with that, and so on and so forth. So those are
Okay.
some of the some help that is needed.
Okay.
And like I said, they're available. I mean, not like they are readily available, but then if parents persist and they look around, they ask questions, they're going to get for their children.
Okay, thank you very much. So before I let you go, Dr. Yetunde, you mentioned something when we were starting this. You talked about the JABA syndrome. Can we talk about the JABA syndrome and how it has affected the medical industry or the medical world?
Hmm. So we are praying that it starts to slow down a little bit because if it continues at the rate at which we started, we are at some point we're just going to be left with maybe those who have retired, you know, and they felt oh there's no point living anymore. But we are hoping that things will get better with our country because that's that's the solution. When things are better with Nigeria, when this especially when the remuneration, the pay and everything is commensurate with what we do, then you will see that it is not because there's nothing that people go to do in those places other than they pay them a whole lot better than
Exactly.
right here. They work more, they're right there, but then when you are working and you are being paid, you are happy. So I'm hoping that that is going to stop or reduce as we move forward. Apart from the medical personnel that are involved, even for somebody like me that um, oversee a private facility, we've started to feel the impact because you have all those therapists or the professionals that I mentioned, they also started to leave. Okay, so you have a speech therapist who you employ fresh from training and he's learned everything. He has had experience, and then one morning he wakes up and say, "I'm sorry, I have to go." And then they start to take permission to go to Lagos for capturing. And you know that problem is coming. I have an appointment at the embassy. You will know that they're on their way out. So you have to start looking for alternatives. And that happens from time to time. So you have trained this person, you've settled down with him or with her, and then he needs to move. I mean, you can't ask them not to go because except you are ready to say, I want to pay you as much as you're going to be. I'm not able to do that at this time. So I'm just, like I said, I'm hoping that it's going to slow down a little bit. Those countries also, they, I think they, by the day, they are just ready to allow everybody to come in because they keep reducing their requirements by the day. So you have, for instance, the points that you need to enter into Canada 2 years ago is not the same right now. It's gone down drastically. So a lot of people were not even thinking before. Now look at, oh, okay, I can go. I'm qualified to go. And so they plan to leave. So it's a serious problem. Um, it's something that we have to really think about. I mean, government hospitals, because it's a government hospital, people will just try to adjust and manage with what is available, even though that's not the best. But for private owner, it's a whole lot to get qualified people because this it requires that you can't just employ somebody to do speech therapy because what would they do or to do ABA? What I get if they don't have the training, but also have the training who are qualified, they are not willing to stay because they want to leave. Also, that's a serious problem for children and families um, of people who have children who have autism and their families.
Wow. I join with you in that prayer, in that hope that the transition stops, because if it continues at this rate, it's going to be very challenging for us, not just for this particular aspect of the medical care, but in every other aspect. Yes. All right. Thank you so much, Doc. It's been an amazing time with you. Thank you for coming on board. Thank you for sharing from your wealth of knowledge. So, what's last word would you want to leave for Fednat Foundation before we call it a day?
So I just want to encourage families who have children with autism to hold on and stay strong. It's it's a long journey. Most times, you cannot tell, how long the journey is going to take. And sometimes the journey might be lonely. It might just be you and the child. Your friends might not be available. Families might desert you, but just keep at it. Look for the best available options for your child. No matter where you are, push for it. Don't give up. Look for the best center. Look for the best person that can provide that care for your child. And keep advocating anywhere you are in school, in with people. Different your family members might even be might not know what you're doing. Keep being the advocate for your child. And in no time you come together as professionals, as families, as friends of people who have autism, we are going to make a whole lot of difference in their lives.
Amazing. Thank you so much, Ma. Thank you for your time once again. We're gonna call it a day here, and I hope that if we call on you next time, you will also respond. And all right, thank
Thank
you.
you.
Yes,
Okay.
bye.
Bye bye. Thank
Thank you.
you. Bye. Bye bye.
Yes.